and they'll be coming in, but we start on time, so we're not going to make you wait. Ready? So good afternoon and welcome to this briefing for the House and Health Government Operations Committee. This is our first session back since 2020 in person. So I ask for your patience if we encounter any technical streaming issues. This briefing is being streamed on the Maryland General Assembly YouTube channel. Panelists will control the transition of the slides. Before this briefing, all members were emailed a copy of each presentation. I want to thank our committee lawyers for that and staff. If you do not have these documents, please let committee staff know and we will send you a copy. Please adhere to our usual committee rules of one question and one answer from the panel, not one question and one answer from each panelist. Please keep your questions brief. Please keep in mind we have a unique schedule today. So this briefing is scheduled to conclude around 2 p.m., which is why I'm starting on time. And immediately following this briefing, we have a bill hearing. And then immediately after the bill hearing, we have another briefing. So today is a new day. Get used to it. The days will be long. At the conclusion of each hearing and briefing, I will announce a short break and the new start because we have to log in again. So just be patient with us because this virtual thing is new and it's a little bit complicated. So today, the House Health and Government Operations Committee will hear a fiscal briefing from the Department of Legislative Services. And we will begin with Mr. David Romans, who we know you very well. Welcome back. And he'll give us a fiscal, and he's the Fiscal and Policy Coordinator for the Department of Legislative Services. Good afternoon. How are you?
Good, thank you. So we're going to put the document up on the screen, I think, as well, so you can follow along if you don't have it. Let's give them a second to get it on the screen. So I'm going to talk at a really high level about the state budget proposal for fiscal 24, just give you the highlights, then happy to answer questions. And then I think after me, our health analysts will be here to give you an overview of the health department at some point today.
Yes, we do. We have them later. After you, we're doing bill hearings.
Okay,
and then we're going to take a break wherever we are at 3:30 and do the health budget.
Okay.
If I can ask you, David, respectfully, will you be so kind? We have 7 people that are new on our committee. Will you also explain things in a way that it's easy?
I will do my best.
Thank you.
There's a lot of new members through all the committees. So.
Thank you.
Okay, so on the screen, you can see the first page of our fiscal briefing. We kind of have a quick look that hits the highlights. Overall, the governor has proposed a $63 billion budget. It actually decreases by a little more than $1 billion compared to last year. The major reason for the decrease in total funding is federal dollars, as there was a lot of federal stimulus money that came in as a result of the pandemic, and the state has been spending its way through that, and that funding is starting to dissipate, so that's why the federal dollars start to fall off a little bit. I should note, though, that there are a number of competitive grants through the Infrastructure Investment and Jobs Act, a federal bill, as well as the Inflation Reduction Act, which is another federal bill that passed recently, that could provide multiple billions of dollars to Maryland if we're successful in competing for the grants, particularly in the transportation, environment, energy efficiency areas. So there could be a lot of federal money added to the budget at a future point in time. But right now, there's none of that money in the budget because we're still going through the grant process. In terms of the general fund, you can see there's about $27 billion. About $1 billion decrease in general funds, as well as the state is, just has less cash. There was a huge surplus a year ago, so there's a little bit less cash to utilize this year. The governor has set aside $820 million of general funds in the fund balance, so he's not spending $820 million of available general funds this year. And the rationale for that, as we understand it, is concern about a recession and trying to hold on to some cash to offset or mitigate the impact of a recession. He's also left $2.5 billion in the state's rainy day fund. That equates to 10% of general fund revenues. So between the two, we have $3.3 billion of cash set aside. This is at an extremely high level, unusually high, but it does well position the state to deal with a recession if one arises in the next year or so. We go to the next page. So this chart shows you the impact of legislative proposals on the governor's budget. There's quite a bit of spending and revenue changes that require legislative action. On the first grouping there, the kind of items contingent on enactment of legislation on the revenue side, there's 3 targeted tax relief proposals from the governor. The first relates to the earned income tax credit. Back in the 2021 session, the General Assembly enhanced the credit to provide larger refundable amounts to eligible individuals. At the same time, in a separate bill in 2021, the General Assembly also made eligible for the earned income tax credit people who lacked a Social Security number. The governor's bill would continue both of those provisions and make them both permanent. And the administration is estimating about $151 million impact in fiscal 24. The second tax item is military retirement income. Right now, the state exempts from the income tax $15,000 of military retirement income if you're over 55, and $5,000 of income if you're below 55. The governor would propose to increase the amount that's exempted from the income tax to $25,000 in the next tax year and $40,000 in the subsequent year. So a substantial increase in the amount that's exempted. And those $25,000 and $40,000 amounts apply to everybody. It doesn't matter what your age is. The third tax proposal is the child tax credit. Maryland has a child tax credit currently. You have to have a disabled child, and you have to have federal gross income of $6,000 or less, so very few people utilize that. What the governor is proposing is to increase the income threshold to $15,000, and for children under the age of 6, any child who meets the income eligibility would qualify, not just disabled children. Over 6 and over, you'd have to still be disabled to qualify. And the estimate of that is about a $20 million impact. So 3 significant tax proposals. Then on the spending side, there's a couple of proposals that have a big price tag associated with them. The most significant being the governor's plan to accelerate the phase-in of the $15 minimum wage. What he would like to do is make that effective October of this year rather than in calendar 25. And that acceleration has a cost because back when the phase-in of the $15 minimum wage was enacted, you all provided for annual rate increases for many healthcare providers, DDA providers, behavioral health providers, and many of the Medicaid home and community-based service providers. And they were supposed to get 4% rate increases in fiscal 25 and another 4% in fiscal 26 to keep up with the phase-in of that $15 minimum wage. Since he's accelerating the $15 minimum wage, he's also accelerating all of those rate increases into fiscal 24. So if you passed the minimum wage bill as proposed, the providers would actually get most of them would get a 12% rate increase this year, the 4% they were supposed to get in fiscal 24, plus the acceleration of the other 8%. Behavioral health providers would end up getting 11%, as the statute calls for a slightly smaller rate increase for them in fiscal 24. And the other big item, also health-related, is that, as most of you probably know, the state has a hospital assessment that supports the Medicaid program. It generates almost $400 million a year through that assessment on hospitals. And the governor is proposing for 1 year only to reduce that assessment by $50 million to provide a little bit of financial relief to the hospital industry. There's a number of smaller items there listed. The Maryland Educator Shortage Act, which I do not believe has actually been introduced yet, is some sort of teacher recruitment initiative that would cost about $15 million. And then there's a couple of smaller items as well. There's also a couple of items that save money contingent on legislation. Somewhat of surprise, the governor has what's called the Budget Reconciliation and Financing Act in. We usually only see these when the state has a significant fiscal challenge and you need to change the law to save some money. There's 2 provisions that the governor put that piece of legislation in for. One, I mentioned already, the hospital assessment has to be reduced in statute. So he's doing that in statute. And then there's a requirement that this year the governor put a little over $1 billion into the state's rainy day fund. Since we're already at 10% of general fund revenues in the rainy day fund, the governor would like to waive that requirement. And if you approve that in the legislation, he would then reallocate that $1 billion for 2 things. $500 million to the state's Blueprint Fund, which is the special fund created to help support the rollout of the Kerwin education reform initiatives, and $500 million into a reserve account to pay for transportation capital needs. It is not specified what transportation project or projects would be funded with that, but it would be there. And money in that reserve account is available for 5 fiscal years, so it could be spent over a number of years potentially. All right, so let's go to the next slide. So this is kind of the bad news in the presentation. So what we're looking at here is the state's general fund structural budget outlook. So what do I mean by structural budget? In this, we're comparing ongoing revenues to ongoing spending. So we ignore fund balances and transfers and things that give you sort of one-time cash. And the blue bars show you what the administration's estimates in their budget highlights book are. And you see a positive structural balance throughout the forecast period. However, by the administration's own admission, what they did not include in that structural forecast is that the Blueprint Fund, the one I just mentioned that funds the K-12 education enhancements, is not going to have enough money starting in fiscal 27 to pay for the rollout of Kerwin. And so if the Blueprint Fund doesn't have the money, those costs are going to fall on the general fund. And when you take that into account, as the red line does, starting in fiscal 27, we have a significant structural budget shortfall. About $1 billion in fiscal 27, grows to about $1.2 billion in 28. And frankly, because the Kerwin implementation goes on through 2034, it would get worse if we were to extend this chart out further as the costs keep growing year after year. So in the near term, this year's budget, there's no particular challenge on the structural budget outlook, but clearly there's going to be a challenge further out, and that'll be something the General Assembly has to grapple with, both this session in terms of making other spending commitments that will impact the out years, as well as thinking about how to address that challenge longer term. And let's go to the next slide. Okay, so for those of you who are on the Spending Affordability Committee back in December, Legislative Services presented you a structural budget outlook then that was much more favorable. And so what's changed? And one of the biggest things that's changed is highlighted on that chart on the screen, which shows you the free and reduced price meal counts for students in the public schools. In fiscal 20, in the fall of 2020 and the fall of 2021, those counts actually dropped by more than 20,000 each year. And it's believed that the reason for that was that families didn't really need to apply for and fill out the paperwork in order for their children to get a reduced price meal, because there were a lot of enhanced federal food benefits. So there was, maybe not as much paperwork completion. This year, however, we see 110,000 more kids were identified as eligible for free and reduced price meals in fall of 2022. And the primary reason for that, some of that is the coming back of some of the families who didn't fill out the forms for a few years. But the other reason is, for the first time ever, the state matched the enrollment in each school against the Medicaid enrollment levels for children who would meet the income eligibility for free and reduced price meals, which is 185% of poverty. And that is the primary reason they identified, more than 100,000 additional kids. So they were identifying kids who probably were always eligible, but for whatever reason, the families didn't complete the paperwork, but now doing the Medicaid match, they've been identified. So the good news is that means all those children will qualify for federally funded, meal assistance at school. The negative impact in terms of the state budget is that free and reduced price meal counts are used in the K-12 education formulas, particularly the compensatory education formula. And for each child who is free and reduced price meal, a school system gets sort of an extra amount of funding, if you will, to help provide services to that child. And the compensatory education part of the formula grows $400 million this year, because there's so many more children in that free and reduced price meal count. And that would be an ongoing cost. So that really depleted the Blueprint Fund much faster than expected, because there's so much more K-12 education costs coming in. So that is the primary driver. Now, I will say the one wild card going forward is that, as most of you probably know, Medicaid has not been doing eligibility redeterminations basically since the pandemic began. And that's because of the federal government gave us extra money, but one of the requirements of getting that money was you couldn't kick people off of Medicaid. So our Medicaid rolls are extremely high right now, and they're going to start doing redeterminations in the spring. And it's likely that some adults as well as kids are going to fall off. So there could be a smaller number of kids in Medicaid next year, which might reduce the number of kids identified when they do the match next year. So there may be some drop off of free and reduced price meal to kids next year. But for now, that's the outlook, and it has a significant budgetary impact. All right, the next page, one of the other things that we showed back in December was we were forecasting about a $3.6 billion surplus for the current fiscal year after taking into account revenue estimates and all of the mandates and other sort of known spending that was going to need to be included in the 24 budget. So what we're trying to show here is, well, what did the governor do to make use of that surplus? How did he spend it? And as I mentioned at the start, he put $820 million into savings. So he's really only spending about $2.8 billion of it. About $2.1 billion goes for what I would characterize as enhancements and initiatives, many of which I've talked about: the money for transportation capital needs, the money for the Blueprint Fund, the minimum wage impact, the revenue enhancements. A couple of others I would note: higher education receives quite a bit more money, about $133 million more than we were assuming. There's a variety of reasons for that: higher personnel costs, some flexibility for the universities to do some enhancements. But one of the other benefits is that all of the public four-year institutions in the state have agreed to cap their tuition growth for in-state students at 2% for this year. A couple of other things I guess I mentioned. One is that even though K-12 education funding goes up a lot, there were two school systems where it did not. It was actually going to drop. And so the governor provided a kind of discretionary hold harmless amount for those two school systems so that they received the same level of funding as they did last year. The two systems are Baltimore City, which would get about $32 million under the hold harmless, and Allegheny County, which gets about $5 million. The Allegheny County is somewhat amusing in that somebody won, I believe, the Powerball, won like $1 billion. And so the county's income tax revenue for 1 year jumped up, and they look very wealthy suddenly relative to other counties. So they get less education aid. That'll obviously change in another year, but for 1 year they look quite wealthy. I think those are the highlights on that chart. Oh, the other thing I want to say with that in the lower part, we show there were some things that weren't enhancements. The governor put in, I don't know, almost $600 million more for sort of ongoing programs just because he had higher estimates than legislative services. And the big area is Medicaid and behavioral health, $432 million. This is largely because he thinks enrollment in the program in the current year and in fiscal 24 will be higher than what we were estimating in the fall. And also, I think behavioral health, just that program costs are going to be higher. This is not initiatives or anything. This is just estimates of the growth in costs. We're a little skeptical of this, but we're going to be looking. We'll have a couple more months of data on both expenditures and enrollment, and we'll be evaluating the adequacy of that. The other thing I neglected to mention on the top part of the chart is one of the other big enhancements in the budget in the health area is the governor put $78 million into behavioral health for what are termed infrastructure investments, but they're not specified. And what we've been told is that the idea is that the new health secretary and her team would get to determine the best investments to make with that behavioral health money. That's something I think the General Assembly will want to follow up with the health department as the session goes on to kind of hear what they're planning to do. All right, let's go to the next slide. All right, so this slide just hits on kind of other key features in the budget that I did not already mention. K through 12 education, second bullet there, grows about $733 million or 9%. That includes direct education aid as well as teacher retirement costs that the state pays. Talked about the healthcare provider rates. A couple other things to mention. Community colleges grow nearly $40 million or 11%. Primary reason for that is the community college funding in the state is driven by two things: the number of students at each community college and the aid per student at the public four-year institutions. And the aid per student at the public four years went way up, so the community colleges kind of ride along with that increase in aid per student. In terms of state employee compensation, so this has been a big issue in recent years. As many of you may probably have heard, I mean, more than 13% of all state positions are currently vacant. This is an extraordinarily high level of vacancies for state government. It's the highest that we're aware of in more than 30 years. So both Governor Hogan and Governor Moore have taken steps in the last year to try to address this. Governor Hogan provided a 4.5% cost of living increase to state employees in November of 2022. No money was actually in the budget to fund that. So Governor Moore got to fund that, both the current fiscal year and the next fiscal year's cost of that, which is about $600 million for that 4.5% cost of living increase. And then Governor Moore for fiscal 24 is providing a 2% across the board salary increase for state employees. Law enforcement officers get 5%, as that was something they collectively bargained with Governor Hogan about a year ago. And then all state employees would be eligible for employee increments, which are sort of moving along the steps, or I almost call them like merit increases for state employees for more years of service, which range from about 2% to 6%. And that's about $400 million of costs between that and the salary increases. So there's a huge amount of money going into state employee compensation with the hope that it will help improve our hiring and get us back to a more normal level of vacant positions. The budget assumes that we're successful in that. It assumes we get back to closer to 7% of positions vacant rather than the 13% or so we are at now. So I know that's going to be a big issue for the budget committees in both houses, trying to focus in on what else can be done to improve employee hiring. One other thing I would note, it's sort of unusual, is the governor set aside $150 million for legislative initiatives, whether they be operating or capital. Now this is a large amount. It's not something we ordinarily see in the budget, so that'll be something that, the budget committees will be grappling with how to best spend that money. I would also note, for those of you who are returning, that this is the first year the General Assembly can sort of reprioritize the budget and move money around to its priorities. So it'll be a brave new world for everybody in the General Assembly in terms of deciding, what money should be moved around. Madam Chair, that's really the high-level overview of the budget. I'm really happy to answer questions if people have them.
That was pretty good. Let's see if there are questions for you. Are there any questions? I have Delegate Lewis, and then I have Delegate Hutchinson, followed by Delegate Taveras.
Thank you, Madam Chair, and thank you so much for this overview. This is like my 6th year in office, and I actually am now finally starting to understand your fiscal reports. So thank you. One of the most interesting budget decisions of our new governor was to set aside, I think you said $500 million for transportation capital investments. How does that relate to legislation we passed a few years ago that mandates MDOT to fund, what's it called, like best maintenance level for the system?
Right, it's on top of all the existing state mandates. So the governor's budget fulfills all of the mandates, transportation and otherwise, in the state budget. So this is sort of a big chunk of money set aside to help supplement the Transportation Trust Fund to do presumably larger capital projects.
And if I may, Madam Chair, if I
Absolutely.
understand how the Transportation Trust Fund works, it's supposed to not be touched, right?
Correct.
But it gets touched.
Well, it was touched a lot during the Great Recession, and the General Assembly since then passed, I believe it was a constitutional amendment that actually makes it very difficult to raid the Transportation Trust Fund. So the money in the Transportation Trust Fund is basically now reserved just for transportation, and it's very hard to remove it. Now, interestingly, this $500 million is not going into the Transportation Trust Fund. It's going into the state's dedicated purpose account. So there's more flexibility there. And
I have now my pleasure Delegate Hutchinson, followed by Delegate Taveras.
Thank you, Madam Chair. Thank you, Mr. Roman. This is the third time I've seen you do this presentation, and every time I understand it just a little bit better. So it's taken some time to sink in. This is sort of like a process or procedural on how the budgeting works. But I'm going to use a specific example. I understand that there were a number of initiatives that Governor Hogan put into the budget that were removed by Governor Moore. And one in specific I'll bring up is a new regional medical center in Talbot County. There was $100 million that was allocated for that. That has since been pulled out, and I understand that there's some negotiations as to whether that or other initiatives would go back in. Was that money all set aside somewhere else, or if that comes back in, does that come out of the $820 million that's left over?
Right, so, yeah, so the short answer is the money comes out of the 820 million fund balance. I would say what Governor Hogan did in December was have a press conference and released a long list of things he would fund, but it was sort of I would characterize it as a wish list of what, if he was putting the budget together, he would do. So, Governor Moore didn't fund all the things on that list. But.
Delegate Taveras?
Thank you. I already reviewed the budget from the first week when y'all released it. My questions on the proposals are, what's the level of prioritization that's being made on the funding set-asides, primarily on the 500s, on the transportation and the, hold on, let me hear. I want to hear myself better, sorry. So, for the education funding on transportation, and what cost corrections are being made in the structural deficits in the outer years to try to figure out how to address those gaps and bring it back into the fold?
So in terms of the 500 millions, I mean, I think the big question on the transportation is what is that 500 million going to fund? Because the governor was not specific as to what it is. It's just reserve. Right.
With the total funding on the school to build to Learn Act and school facilities at 1.1 billion, I need to direct my questions to the IAC.
In terms of which specific schools are prioritized, yeah, the IAC kind of drives the process of how to, what schools are the priority, along with the local governments. But
Okay, thank you. We have Delegate Chisholm, followed by Delegate Shalega.
Thank you, Madam Chair. And David, thanks again for doing the presentation. You and I had a talk about this the other day about the free and reduced meals, but you said something that confused me a little bit because I'm not sure if I followed correctly. So right now, the past couple of years, the federal government has been funding through SNAP primarily.
right.
Counties typically pick up that or receive that money for the free and reduced meals, but what you were saying is it's going to cause a state deficit because the state's now going to pick up a good portion or pick up some of the services that wrap around that. Can you explain?
Yeah, let me clarify. I'm sorry, it is confusing. So there's sort of two things that the free and reduced price meal counts are used for. One is for what you'd think they were used for free and reduced price meals and who's eligible. And that is all paid for by the federal government. The state has a couple of small supplements, but it's basically a federal program. So that 110,000 kids are just going to receive the meals, and it's going to be funded by the federal government. The other piece thing we do with the free and reduced price meal counts is we use it to allocate state aid for, it's sort of a proxy for disadvantaged students. So each school system gets extra money for each disadvantaged student, which is the free and reduced price meals, for educating them, not for meals, but to educate them. And that 390 million increase I talked about is additional education dollars going to the school systems to help educate those kids.
Sure.
Correct. That's a separate part of the formula that allocates extra money to the school systems for each ESOL eligible child.
Thank you, Madam.
My pleasure. Delegate Shalega.
Madam Chair, can we look at page 19
Sure.
of your packet, and it talks the general fund end of year balances?
Yes.
Can you just kind of walk us through that for a minute?
Okay, yeah, so hopefully you're all looking at it on your computers. So at the end of fiscal '22, the state had a general fund cash balance of $5.5 billion because, for two reasons. One, the state left a lot of money when you worked on the budget. And last year, you left a huge balance. You knew you were going to have it. And then state revenues, even though they've been updated last March, came in much stronger at the end of the fiscal year, like almost $2 billion stronger than was expected. So we ended up with an enormous cash balance at the end of fiscal '22. And that also resulted in a large structural balance. I would say one of the big reasons we had that huge surplus is capital gains blew away expectations in the most recent tax year. So then in fiscal '23, the cash balance falls to $2.3 billion. A couple of reasons for that. One is the state put an extra $1.3 billion into the rainy day fund last session. So some of that surplus kind of went there. And then the state has started spending down that surplus on various priorities and initiatives. There was some tax relief passed last session and so forth. And then again in fiscal '24, the cash balance falls to $820 million as we again continue to spend down some of that surplus on both short-term and ongoing costs. I mean, one of the things that a lot of money went to in fiscal '23 and again in '24 is capital. We spent $2.3 billion of cash last year, fiscal '23, on capital projects. And the governor's proposing to spend about $800 million of cash in fiscal '24. So we've been whittling away that big surplus, but a big part of it is on, one-time things, putting money in the rainy day fund and on capital projects.
Up total funds available, so that working total funds available, 30 billion was that because of federal funding? I mean, it's a huge jump.
This is just general fund, so that's because we had such a big cash balance at the end of fiscal '22 that rolled into '23.
Up into that,
Yes.
that's what I was
Yes.
wondering. Okay, thank you.
Any other question for this witness? Delegate Olston?
Thank you, Madam Chair. I was just wondering if you could go back and talk a little bit more about the structural deficit that we're going to be seeing, and if there are any recommendations as to how to close that gap.
Right, it is a big gap. Again, for those who've been around, that it's very common for the state to have a structural budget gap in the out years. It's not a good thing, but we often have been in this place. I think the General Assembly and the budget committees and Ways and Means are going to have to really weigh what the best approach to dealing with that is. Whether, it could be making some spending reductions in various places, slowing down the rollout of Kerwin, generating new revenues. I mean, there's, I think the whole range of options is there. And of course, since it is a few years out, there's a little bit of time to think strategically about what the best combination of actions is. But it is something that the General Assembly is going to have to deal with. And the other worry, and not to be doom and gloom, is if we get a recession, that's going to get worse. So then it becomes a bigger challenge. I mean, right now, the state's revenue forecast is that we avoid a recession, we grow kind of modestly in the next year or two, but that we keep growing. And so that turns downward, that would make the challenge greater.
I'm going to allow it, but really it's one question only, okay? And only because we're still a little early, but so go ahead and ask the question.
Thank you. Thank you for your generosity. Madam Chair. What's the effect from the Fed on the increasing inflation rates could have on the state finances at this point? Do you see any potential?
The expectation is that, from most of the forecasters, is that inflation is going to begin to slow going forward. So I think the impacts are what we're seeing right now. I think that's part of why we're seeing such a high level of vacancies in state government, is that all employers have been struggling to compete for workers, and salaries have been going up in the private sector as well. So I think we're seeing that inflation. And I mentioned how state salaries are growing. The other area that I think the state government is really seeing an impact of inflation is the capital budget. There's lots of projects, state plans for capital projects. We have a 5-year plan, and some of those projects have gotten much more expensive because the inflation in the construction market is extremely high. I think it's estimated at about 20% in this most recent year. So we're seeing a lot of additional costs for projects that were already planned in our capital plan.
Okay, thank you. I don't see any other questions, so thank you so much for being with us today, David. We really appreciate your work. Thank you. And if you have any questions for the committee members, you can reach David offline, and he's really good at his job, okay? Thank you. Thank you so much. So for the committee, I did say earlier that this is going to be a little bit of a different day. So we had now the fiscal briefing, and then it was supposed to end at 2 o'clock. It's 1:36. What we're going to do is we have bill hearings at 2 o'clock, and then we have a budget briefing, the health part of the budget, at 3:30. So we're going to take, it is 1:36, we're going to come back at 2 for the bill, like we said, because the witnesses are going to be here too. And wherever we are regarding the bills, we will stop at 3:30 to do the budget briefing because we told DLS to be here at 3:30. It may be that we will end earlier, but it could also be that we will do the briefing and finish the bills later. So I just need your flexibility, and please be at your seats at 2 o'clock because we have some important bill today, and we also have the Secretary of Health here today that will testify on one of the bills, okay? Thank you. 2 o'clock on the dot. And there's food in the back, so make sure you go and get some food. Thank you. Okay? Yeah. Yeah, let's do 6 to that first. Thank you.
I don't think it'll be long, and we can even, if you want, well, it'll be
No,
fine.
you're gonna put it on.